Okay, so our dashboard assignment is going to be on acquired pressure ulcers, and the group includes Logan Sargent, Jacoria Coffey, Haley Holston, Hannah James, Kayla Kerr, Megan No, and Nicole Simmons. This is Logan Sargent, and I will be talking about the overview of quality safety measures in organizations. So, what is a quality dashboard? Quality dashboards, these are condition specific, actionable web based applications for quality reporting and population management that is integrated into the electronic health record. They provide feedback on different benchmarks and performance goals that have been implemented. These dashboards will help medical professionals improve patient care and the patient's outcomes. So, what is a quality indicator? These are standardized evidence based measures of health care quality that can be with available hospital inpatient administrative data to track and measure the clinical performance of healthcare providers and the outcomes of patients. So, how is a dashboard used in nursing at the organizational level and at the unit level? At the organizational level, they are used to see if goals are being met and if the nurse's performance is on target with the goals that have been set. They can then implement new guidelines, goals, and policies to help achieve quality patient care. So for acquired pressure ulcers in our dashboard, they stay pretty well consistent throughout all the quarters. The organizational level could look at that and implement a new procedure to see if it decreases the amount of acquired pressure ulcers. At the unit level, it can be used to evaluate how well the unit is doing in certain areas so they can be improved upon. In quarter two, acquired pressure ulcers were at their highest at 5, but in quarter three they were at their lowest at 3. So the unit looked at the data in quarter two and improved in that specific area to lower the amount in quarter three. So how is the data collected? Data for quality dashboards is collected through the electronic health record and is stored in a data warehouse. The data warehouse then compiles and stores all the data such as vital signs, health maintenance medications, problems, enterprise master patient indexes, and laboratory results. This information that has then been collected will then be put into a quality dashboard for medical professionals and the administration to review.
Overall, the data in the dashboard for acquired pressure ulcers does not have a trend. However, from quarter one to quarter two, there is an increase, then from quarter two to quarter three, there is a decrease, and finally from quarter three to quarter four, there is another increase. We need to measure this indicator to look for trends in data, whether it is an increase or a decrease. If it is an increase, something in preventative methods isn't being done properly, and if it is a decrease, whatever preventative methods are being done are working for the issue. CMS measures are not an issue with acquired pressure ulcers. Many hospital organizations have implemented successful programs for the prevention and management of pressure ulcers across a range of facility types.
This is Kayla Kerr with Investigating the Problem. So one of the problems with pressure ulcers are the lack of resources used. There are so many resources that no one really talks about, such as ultrasound, thermography, subepidermal moisture measurement, alternative light sources, laser Dopplers, and so many other things. The early detection is imperative, and technologies that can be used and that are effective are ultrasound, thermography, the subepidermal moisture measurement, and light. Understaffing is another problem, and understaffing can lead to nurses not evaluating like they should, and they wouldn't turn the patient as often because they would be doing other things. Some nurses do not pad bony prominences, and some people just don't know what they're doing. So, like, there was a research sample in Brazil that was composed of 38 nurses, and a majority of them scored between 70 and 89% of the instrument items, and only 2 nurses out of the 38 scored 90% or higher. The lowest accuracy items are related to the use of devices such as water, gloves, cushions, and items about positioning and repositioning and bony prominence massage. And below we have our sources.
This is Nicole, and I'm going to be talking about addressing the deficits or preventing pressure ulcers. One of the things that we can do initially is to use a pressure ulcer risk assessment tool, and an example of this would be the Braden scale. It addresses certain risk factors and uses those to predict the level of risk for a pressure ulcer on a client. The lower the score, the higher the risk for a pressure ulcer to develop. Also, protecting bony prominences is an important aspect. These areas are at much higher risk for developing lesions because they're under higher pressure when the patient is laying in bed. In addition, a pressure relief mattress will help to reduce the pressure on those pressure points, and that reduces the risk of developing a pressure ulcer. Also, this is super important, changing position every 2 hours helps to increase blood flow, and that promotes healthy skin and prevents those pressure ulcers from happening. Also, this kind of goes with the last one, but you keep the skin clean and dry, and it reduces the risk for infection and developing those sores. This is Nicole, and
This is Megan, and I'm going to be talking about the application to EHR client in regards to pressure ulcers. To start, looking at the use of the EHR and data that has been used. The EHR data used is the Braden score. This scale takes into account of the sensory, perception, moisture, activity, mobility, nutrition, friction, and shear. Collectively, this total score calculates the risk factor for the patient's likelihood of getting a pressure ulcer. The EHR also collects additional information that could be used as indicators of the patient's likelihood of getting a pressure ulcer, such as medication and other diagnosis features. Second, how does the EHR facilitate the process related to quality improvement and data collection? The EHR facilitates the process of quality improvement and data collection because of the features that are within the recording system significantly improves the predictivity power in determining pressure ulcers. Incident reports are used in the EHR program to document all of the hospital-acquired pressure ulcers regardless of the staging. The certified wound care nurse can then use this program to check the patient and add to the chart anytime throughout the day. The EHR allows for recommendations and interventions to be documented and recorded throughout the patient's stay until that pressure ulcer is healed or until the patient discharges. Lastly, how do you find that the EHR facilitated the process? It is found that the EHR tracking systems are able to facilitate early identification of hospital-acquired pressure ulcers and to decrease the rates through preventative care. Study results show improved early identification, which can help facilitate initiation of effective care, staff education, and improvements in practice. This has helped nurses learn strategies for preventing pressure ulcers in specific locations on the patient. The system also helped record medical devices that are required for the care and how to use those specific devices. This has helped to reduce the risk of pressure ulcers. The success of this tracking system through the EHR has shown through many incident tracking models, combined with intensive multidisciplinary reviews and metrics tracking to demonstrate that there is a decline in hospital-acquired pressure ulcers through their rates.
Hi, I'm Jacoria, and I'll be explaining the nurses' roles and leadership skills needed to implement change. Alright, so firstly, there are many methods or ways that you can implement change as a BSN nurse. One way is to send out emails about the issues, and our issue that we're discussing is healthcare acquired pressure ulcers, okay? And so you can send out the issues, and you can send them the actual dashboard of information so they can see the trends of what's going on. A lot of hospitals implement reading signs. They'll have a big like poster or paper printed either in the bathroom, in the staff room, at the nurses' stations, just in the staff areas where the nurses have to read it and they can sign off saying that they've read it and they understand everything. Um, the BSN nurse can meet individually with the other workers and discuss the issue and see how everybody understands everything and see, everybody's idea and opinion of everything. And then you should also explain the importance of the acquired pressure ulcers. Okay, another way you can implement changes is have staff meetings or staff trainings on pressure ulcers. If they do that, then you can make it mandatory that every staff member has to attend at least one meeting on a training so everybody can be retrained. All right, so then you could also hang reminders all over the bathroom, all over the hospital, on signs and pretty posters and stuff, just so everybody can see it. All right, and then lastly, you can have informational handouts that you can give staff that'll be educational and just helpful tips that everybody can read so they can have it on their own. All right, so one way that the BSN nurse can monitor the change is doing anonymous surveys and seeing the staff's opinions on what's going on with the changes, if they think everything's working, just their whole, so you can have their whole idea on everything. And then the BSN nurse can also host observations, like she can follow the other nurses in their rooms while they're doing their procedures and make sure that they're doing everything in the correct order and following the new guidelines that were set in place. All right, and then there's always feedback sources they can use, like it could be a paper assessment, and it could just be a trial and error, and it can be the nurses stating how they feel the new implementations are working. All right, and then ways that technology can be used is, like I said, surveys. You can make the BSN nurse can make surveys that are anonymous on SurveyMonkey and have everybody fill it out. And like I said, they could also it could be very informational. It could, help provide feedback on how everybody feels about the new implementations. Then you could have paper or online questionnaires. It's just like a trial in there also, and you fill that out, and it'll just give the BSN nurse or the charge nurse just a bigger understanding of why everything could be going on and how everybody feels about it.
Hello, my name is Haley Holston, and I'm going to be talking about informatics and nursing. Informatics is using information science to solve problems by using data. Relating that to implementing to patient care and outcomes, it allows the patient's chart to be easily accessible. It allows more team members of the healthcare to have quick access to the patient's chart, which essentially improves the speed of communication through healthcare and essentially improves the patient's care and outcome overall. Informatics is used to collect, communicate, and interpret data, further used for evidence-based practice and improving the patient's care. Data mining is discovering new patterns in a set of data. Informatics relates to this topic because it is the information given to help observe and study the statistics of the data. With our scenario having acquired pressure ulcers and looking at the data, I would recommend having a pressure ulcer risk report on a patient to help prevent further pressure ulcers. According to the article Clinical Informatics and its usefulness for assessing risk and preventing falls, pressure ulcers in nursing home environments, the facility that highly used a risk report, I guess according to the article, like more often and was always a part of their care plan, only had 10 ulcers that month compared to the facility that had it but didn't really use it. Or if they did, like some nurses used it, some nurses didn't. Um, they had a 36% with acquired pressure ulcers. So this proves that by having a risk report, you will lower the chances in having actual acquired pressure ulcers. And so, um, especially with informatics, that plays a lot in role with that. Hello, my name is Haley Holston.
This is Logan Sargent, and I will be summing up our presentation. So, what is the role of performance measures? This is a process in which an organization monitors important aspects of its program systems and care processes. This data is collected over time and will typically drive the organization's decisions. The data is typically compared to the organizational goals and objectives. This will then tell the organizations which areas to improve upon. So, why is observing for performance deficit important? A performance deficit is the inability to be able to complete tasks due to a lack of skills related to either physical, cognitive, or psychosocial skills. So, by observing for a performance deficit, an organization can see if its nurses are lacking the physical, cognitive, or psychosocial aspect of caring for a patient in a certain area. How could using best practices improve the deficit? By using the best practices available, we can improve the deficit. If nurses use best practices, they will be able to physically care for their clients better, therefore lowering the deficit. If nurses are educated on the best practices for acquired pressure ulcers, they will be able to decrease the deficit because they will know the best way to care for patients to eliminate the risk of them developing in the first place. Best practices will always improve a performance deficit because they are the best way to care for a client. So there will be no deficit if the best practices are implemented. What is the financial implication for hospitals? One of the biggest financial implications for hospitals is not being able to staff enough nurses or medical providers to care for their patients. This lowers the quality of care a patient receives because it increases the workload on one nurse or medical professional. Also, by not being able to buy materials and the latest equipment, the nurses cannot implement best practices to care for their patients. Hospitals struggle financially when care is provided and money is not received. So when money is not received for the care given, the quality of care a hospital can provide significantly goes down because they have lost money and are not able to recuperate that money to then give better care to another patient that comes in.